Today, we're diving into a topic that's often overlooked but gaining increasing attention: the link between metabolic factors and mental health. Many people think mental health issues are mostly related to neurotransmitter imbalances or stress. However, recent research has shown that metabolic problems might actually be a major culprit. The condition we're discussing today, MTHFR deficiency, is a prime example. It's a genetic metabolic disorder, IEM. And while it's invisible and hard to detect, its impact on our health can be huge. Not only can it lead to seizures and cognitive issues, but it can also cause more severe symptoms like mood swings and hallucinations. So, what exactly is MTHFR deficiency? Simply put, it disrupts folate metabolism, causing elevated homocysteine levels in the body. This, in turn, affects brain function and can trigger a range of metabolic mental health disorders. Let's take a closer look at how this metabolic issue plays such a crucial role in mental health. 1. MTHFR deficiency. MTH deficiency affects the way our body processes folate. Folate is a vital nutrient that's involved in many important physiological processes. MTHFR is a key enzyme that helps us process folate. When this enzyme isn't working properly, it leads to elevated homocysteine levels and lower methionine levels in the body. This metabolic imbalance doesn't just affect heart health, it can also cause issues in the nervous system and mental health. So, while MTHFR deficiency might sound abstract, it has a profound impact on our overall health and definitely deserves our attention. 1. The role of the MTHFR enzyme. The main job of the MTHFR enzyme is to help convert a substance called 5,10-methylene tetrahydrofolate into another substance called 5-methyl tetrahydrofolate. It might sound complicated, but this is a crucial process. 5-methyl tetrahydrofolate is the active form of folate, and it plays a role in several key biochemical reactions in the body, especially when it comes to processing homocysteine. If there's an issue with the MTHFR enzyme and homocysteine can't be properly processed, it builds up in the body. This can then affect our neurotransmitters like serotonin and dopamine, and may even alter the structure of our nerve membranes, increasing the risk of neurological diseases. 2. Homocysteine, or HCY, is an amino acid. When it accumulates in the body, it can become toxic to our blood vessels and nervous system, potentially leading to problems like heart disease or stroke. In fact, high homocysteine levels are an independent risk factor for stroke and cognitive decline, especially affecting the small blood vessels in the brain. To prevent this, 5-methyl tetrahydrofolate acts as a methyl donor and helps convert homocysteine into methionine, which is essential for the body's normal functions. So, as you can see, MTHFR and these processes are closely connected, and keeping the enzyme working properly is crucial for our health. 3. Clinical manifestations of MTHFR deficiency. The symptoms of MTHFR deficiency can vary depending on the age of onset and the level of enzyme activity. For infants and children who develop symptoms early, the symptoms are typically severe. These children may show signs of weakness, weak crying, difficulty sucking, and poor feeding shortly after birth. As the condition progresses, they may experience seizures, altered consciousness, and even respiratory suppression. These children often also have microcephaly, developmental delays, and even progressive white matter damage in the brain. High homocysteine levels can also damage blood vessels, making babies more prone to thrombosis and cardiovascular complications. Even worse, stressors such as infections, malnutrition, or anesthesia can suddenly worsen the symptoms. For teenagers and adults, the symptoms may be more subtle and varied. Common signs include movement disorders and gait abnormalities. Some patients may experience leg stiffness, difficulty walking, or foot inversion, which can even progress to spastic paraplegia. Cognitive impairment is also a significant issue, with about 74% of patients showing memory loss, inattention, and even intellectual decline. This is often associated with white matter lesions in the brain and low methionine levels. In addition, about 50% of patients may experience seizures, and some may suffer from recurrent encephalopathy and altered consciousness. Psychiatric symptoms like hallucinations, mood swings, or depression are also possible and tend to appear before neurological symptoms, making them easily misdiagnosed as primary psychiatric disorders. Additionally, due to high homocysteine levels, some patients may develop thrombosis, leading to conditions like venous thromboembolism or stroke. Given the wide range of symptoms, many patients may be misdiagnosed for years before receiving the correct diagnosis. Early screening and diagnosis are crucial, especially when there are unexplained psychiatric or neurological symptoms. The good news is that supplementing with betaine, folate, vitamin B6, and B12 can improve symptoms in some patients, particularly when it comes to gait, cognition, and psychiatric symptoms. So, early diagnosis and treatment are key. 4. MTHFR 677T and A1298C polymorphisms. The C677T and A1298C mutations affect MTHFR enzyme activity, increasing the risk of the disease. The C677T mutation, in particular, causes a 30% to 65% reduction in enzyme activity. The T/T variant is more common and is closely linked to cardiovascular disease, stroke, and psychiatric disorders. While these mutations reduce enzyme activity, they do not mean a complete lack of MTHFR. Instead, they indicate reduced metabolic capacity. People with these mutations, especially under conditions of folate deficiency or other stressors, may experience mild metabolic problems. These symptoms are often subtle and harder to detect. Furthermore, individuals with these mutations, particularly heterozygotes, those inheriting one mutated gene from each parent, tend to exhibit symptoms that fall between normal and homozygous mutations. This explains why some people, in specific situations like folate deficiency or additional disease stress, may develop mild hyperhomocysteinemia and corresponding health risks. 5. Factors that worsen the condition. Because these patients already have a metabolic state of low methionine, high homocysteine, any further depletion of folate or B vitamins, inhibition of methionine synthesis, or factors that increase homocysteine levels can rapidly worsen the condition. For instance, anti-epileptic drugs like phenytoin and phenobarbital can speed up the breakdown of folate and riboflavin, among other vitamins. Phenytoin also lowers serum vitamin B6 levels and directly inhibits MTHFR activity, causing elevated homocysteine levels and worsening psychiatric symptoms. So, patients with MTHFR deficiency who need anti-epileptic treatment may want to consider switching to lamotrigine or levetiracetam and supplementing with folate, vitamin B6, and B12. Additionally, certain drugs interfere with folate metabolism, such as methotrexate, trimethoprim, when combined with sulfamethoxazole, valproic acid, and sulfasalazine. These drugs inhibit normal folate metabolism, reducing the supply of active folate and increasing homocysteine levels. For MTHFR deficiency patients, if these drugs are necessary, it's important to closely monitor homocysteine and folate levels and supplement with the necessary vitamins. Another concern is anesthetic drugs, especially nitrous oxide, which should be avoided. Nitrous oxide inhibits vitamin B12, disrupting methionine synthesis and raising homocysteine levels, potentially leading to neurodegeneration. For these patients, it's best to choose anesthetic drugs like propofol or sevoflurane, which do not affect homocysteine levels. Finally, there are other factors that can worsen the condition, such as infections, fever, malnutrition, or metabolic stress from surgery, pregnancy, or rapid weight loss. These factors can make the condition significantly worse. 2. Psychiatric symptoms of MTHFR deficiency. 1. Psychotic symptoms. MTHFR deficiency doesn't just affect the body. It can also lead to serious psychiatric issues like hallucinations and delusions. For example, one 15-year-old patient developed hallucinations and paranoid delusions due to MTHFR deficiency. But after folate supplementation, the symptoms significantly improved. Another male patient experienced auditory hallucinations, delusions, and seizures after an infection. With treatment, he also recovered. These symptoms are related to elevated homocysteine levels in the body, which disrupt the synthesis of serotonin and dopamine, leading to cognitive and emotional issues. Some late-onset patients may also experience anxiety, tension, and catatonia, but these symptoms can improve with treatment. Additionally, some psychiatric symptoms are triggered by medication or metabolic stress. For instance, some patients on anti-epileptic drugs may experience auditory hallucinations and personality changes. When they stopped the medications and added folate and vitamins, their symptoms improved. Also, blood clots can cause psychiatric problems, but treatment can help alleviate the symptoms. A unique case involves psychiatric disorders caused by blood clots. A 2025 report mentions a 17-year-old girl who was hospitalized for acute psychosis. Doctors found she had a venous sinus thrombosis and carried the MTHFR gene mutation. She showed signs of confusion, euphoria, and impulsivity. After anticoagulation therapy and metabolic correction, her symptoms improved. 2. Emotional and behavioral abnormalities. Depression and bipolar disorder are common mental health issues in patients with MTHFR deficiency. Research has shown that the C677T polymorphism of MTHFR is linked to a higher risk of depression and bipolar disorder. People with the TT homozygous variant are more likely to develop these conditions, and their symptoms tend to be more severe. This is especially true in male patients, where the impact of C677T polymorphism on mood is more significant. Anxiety and emotional instability are also frequent symptoms of MTHFR deficiency. The MTHFR enzyme helps generate SAMS adenosylmethionine, which is crucial for the synthesis of neurotransmitters like dopamine and serotonin. If folate and vitamin B12 are deficient, SAM levels drop, which disrupts the production of these neurotransmitters, triggering anxiety and mood swings. Studies show that people with MTHFR mutations often have lower levels of folate and vitamin B12, increasing the risk of anxiety and depression. Some patients may also experience personality and behavioral changes like impulsivity, aggression, or unstable relationships. Preliminary research suggests that the A1298C polymorphism of MTHFR may be linked to borderline personality disorder, which is characterized by emotional instability, impulsivity, and even self-harming behavior. 3. Cognitive decline. MTHFR deficiency can also lead to attention deficits, memory loss, and even early onset dementia. Research shows that in adolescents and adults with MTHFR deficiency, 74% experience cognitive decline. Of these, 50% have seizures and 17% develop psychosis. Nearly all of them eventually experience gait abnormalities or spastic paraplegia. So, why does MTHFR deficiency lead to cognitive impairment? This is closely related to white matter lesions in the brain, low SAM levels, and high homocysteine levels. A lack of SAM affects the synthesis of neurotransmitters in the brain, leading to a decline in attention, memory, and executive functions. 4. Developmental disorders and other psychiatric conditions. First, attention deficit hyperactivity disorder, ADHD, may be linked to the C677T polymorphism of MTHFR. Research has found that children with this mutation often exhibit symptoms like inattention, impulsivity, and hyperactivity. Additionally, autism spectrum disorder, ASD, is associated with the C677T mutation in MTHFR. This mutation is more common in individuals with autism and their mothers, and research suggests it may increase the risk of developing the disorder. Eating disorders are also a concern. Studies show that patients with anorexia nervosa have a significantly higher incidence of the C677T, or A1298, C polymorphisms of MTHFR compared to the general population. Girls, in particular, are 2.66 times more likely to carry these mutations than the general population. Finally, obsessive-compulsive disorder, OCD, and other mood disorders are also linked to the C677T polymorphism of MTHFR. People with the TT variant may be more prone to developing anxiety or OCD due to insufficient neurotransmitter methylation. 3. Case studies of MTHFR deficiency. 1. A sibling pair diagnosed with ADHD and ASD. In one family, a brother and sister were both diagnosed with attention deficit hyperactivity disorder, ADHD, and autism spectrum disorder, ASD. Their symptoms started showing at a young age, but it wasn't until later that the family realized the underlying cause might be MTHFR deficiency. MTHFR deficiency is closely linked to our folate metabolism and the conversion of homocysteine, processes that are essential for brain function. The brother was diagnosed with attention deficits and autism at the age of 4. His mood was extremely unstable, and he struggled to fit in at school. The sister also started showing similar behavioral issues at age 3. As she got older, her social and learning abilities remained significantly impacted, especially when it came to emotional regulation and following instructions. The family tried several medications, but the results weren't ideal, and the side effects became a concern. Eventually, they decided to have genetic testing done, and the results showed both children had MTHFR deficiency. Doctors explained that MTHFR deficiency leads to abnormal folate metabolism, which in turn affects neurotransmitter synthesis, closely linking it to conditions like ADHD, ASD, depression, and other psychiatric symptoms. After learning this, the family began supplementing with L-methylfolate. To their surprise, within just 2 weeks, the children's behavior and mood showed significant improvement. The brother became less irritable, his social skills improved, and he was able to interact with peers more normally. The sister's mood also stabilized, and both family members and teachers noticed a clear improvement in her performance at school. This case highlights how MTHFR deficiency can indeed trigger psychiatric symptoms, and how folate supplementation can effectively improve these symptoms. MTHFR deficiency affects brain neurotransmitters like serotonin and dopamine, influencing mood and behavior, which can lead to issues like anxiety, depression, and attention deficits. The C677T polymorphism, in particular, is closely linked to an increased risk of ADHD, autism, and other psychiatric conditions. Through the story of this brother and sister, we can see how genetic metabolic brain disorders can be alleviated with nutrient treatments like folate. While MTHFR deficiency isn't the sole cause of all mental health disorders, it offers a new research direction. With genetic testing and early detection, we can better assist these patients, improve their quality of life, and help them cope with mental health challenges. MTHFR deficiency isn't just one family's story. It reveals the potential mechanisms of metabolic psychiatric disorders in mental health. Understanding and treating this condition might be the key to unlocking mental health challenges. 2. Drug-induced psychosis. A Japanese patient developed psychiatric symptoms during treatment for epilepsy, and these symptoms were closely linked to a genetic mutation in his MTHFR gene, the C677T variant. This patient had a normal development from birth, and there were no major issues in his early life. But at the age of 10, he began exhibiting strange behaviors, such as suddenly running into the street, experiencing sudden sleep attacks, and even changes in his personality. By 13, he had his first seizure. After tests, he was diagnosed with frontal lobe epilepsy. However, despite trying multiple anti-epileptic medications, his condition was never effectively controlled. At 17, doctors prescribed phenytoin and phenobarbital, two common anti-epileptic drugs. To his surprise, 6 months later, the patient suddenly started experiencing auditory hallucinations and symptoms of multiple personality disorder. These psychiatric symptoms gradually worsened, even though the drug levels remained within the therapeutic range. Over time, his symptoms intensified, including emotional instability and cognitive confusion. When the patient was 23, he was hospitalized due to tonic-clonic seizures. After genetic testing, it was revealed that he was a homozygous carrier of the MTHFR677T gene mutation, meaning he had a problem with folate metabolism. MTHFR deficiency is a metabolic disorder that causes elevated homocysteine levels and lower methionine levels in the body. This metabolic imbalance severely affects neurotransmitter synthesis, leading to psychiatric symptoms. In addition, the patient had deficiencies in folate, vitamin B6, and vitamin B2, which further exacerbated his psychiatric symptoms. Doctors started supplementing him with folate, vitamin B6, and vitamin B12, and switched his medication to lamotrigine, replacing phenytoin and phenobarbital. Fortunately, after this treatment, his auditory hallucinations and multiple personality symptoms significantly improved. His mood stabilized, and his cognitive function showed recovery. This case teaches us that the symptoms of metabolic psychiatric disorders can sometimes resemble common psychiatric illnesses, but their root cause may be metabolic abnormalities. Especially when psychiatric symptoms induced by medication don't improve with further treatment, we should consider the possibility of a metabolic issue. Through genetic testing and metabolic screening, we can detect potential genetic metabolic brain disorders earlier and create personalized treatment plans for patients. So, when dealing with mental health issues, early diagnosis and treatment are crucial, and metabolic disorders might just be the real cause behind the symptoms. 4. MTHFR deficiency. How the HCY pathway damages the brain. First, let's look at the role of the MTHFR enzyme. It helps convert 5,10-methylene tetrahydrofolate into 5-methyl tetrahydrofolate, which then aids in converting homocysteine into methionine. This conversion process is crucial because methionine, SAM, is a very important methyl donor in the brain. SAM is involved in the methylation of DNA, proteins, and neurotransmitters. However, when MTHFR deficiency reduces enzyme activity, homocysteine levels rise while methionine and SAM levels drop. This directly affects brain function and can even lead to neuronal damage. Next, elevated homocysteine levels are highly toxic to the brain. Homocysteine activates NMDA receptors, allowing calcium ions to excessively enter neurons, which causes exotoxicity and neuronal cell death. High homocysteine also damages the small blood vessels in the brain, leading to microvascular disease and demyelination, issues that are closely tied to the brain's structure and function. Studies have shown that people with the MTHFR677T gene mutation tend to have a higher burden of white matter damage in the brain. Many studies confirm this pathway: MTHFR gene mutation, elevated homocysteine, white matter lesions, and cognitive impairment. What's more, this process closely mirrors the mechanisms seen in genetic metabolic brain disorders, GMBDs. GMBDs are brain injuries caused by inherited metabolic disorders, IEM, typically due to enzyme deficiencies that lead to the accumulation or reduction of certain metabolic products, which then harm nerve cells. MTHFR deficiency falls into this category of metabolic abnormalities, and the neuronal damage and functional impairments it causes are very similar to those seen in GMBDs. In summary, the pathological process of MTHFR deficiency is as follows. The MTHFR gene mutation reduces enzyme activity, impairing folate metabolism and the methylation pathway. As a result, homocysteine levels rise and methionine and SM levels drop. This disrupts neurotransmitter synthesis and reduces neuronal repair capabilities. As homocysteine levels rise, it causes white matter lesions, small vessel disease, and even cognitive and motor impairments through excitotoxicity, oxidative stress, and vascular damage. The end result of this process is the various psychiatric symptoms, behavioral abnormalities, and cognitive issues we see. So, as we can see, MTHFR deficiency isn't just a simple metabolic problem. It actually impacts several aspects of brain health. Understanding these mechanisms helps us better identify and treat the mental and neurological issues caused by metabolic abnormalities. 5. For deficiency and mental health, how folate affects our mood and cognition. MTHFR deficiency is an important condition within the group of inborn errors of metabolism, IEM. It's closely related to folate metabolism abnormalities and is directly linked to a number of mental health issues, particularly autism, depression, anxiety, and other psychiatric symptoms. Folate is the cornerstone treatment for MTHFR deficiency. In many cases, supplementing with folate can effectively lower homocysteine levels in the blood, which in turn can reduce symptoms caused by MTHFR deficiency, especially those related to mental health. However, it's important to note that the psychiatric symptoms caused by MTHFR deficiency are just one part of metabolic psychiatric disorders. Metabolic psychiatric disorders are neurological problems caused by various genetic metabolic disorders, often involving the accumulation of metabolic products, neurotransmitter synthesis imbalances, and neurovascular dysfunction. While MTHFR deficiency is one of the causes, other IEM diseases, such as phenylketonuria, mitochondrial disorders, lysosomal storage diseases, and urea cycle disorders, can also lead to similar mental health issues. Not all metabolic psychiatric disorders can be improved with folate supplementation. Different metabolic disorders may require different treatment approaches. For example, mitochondrial diseases might require energy supplementation therapy, while amino acid metabolism disorders may need a low-protein diet. So, when treating metabolic psychiatric disorders, it's not just about folate supplementation. It's essential to choose the most appropriate treatment based on the specific cause and mechanism. Autism and folate, a complex connection. Autism isn't just about folate deficiency or supplementation. Excluding other factors like brain injury or poisoning, autism is a psychiatric disorder caused by genetic metabolic brain disorders, GMBDs. Not all autism cases are linked to folate metabolism issues. While folate-related metabolic diseases can be a cause, they're not the only one. Most autism cases have unique genetic causes, which can be identified through genetic testing and metabolic profiling. This helps create personalized treatment plans. Each treatment plan should be tailored to the individual, in collaboration with a specialized medical team. Conclusion: as the relationship between MTHFR deficiency and metabolic psychiatric disorders gains more recognition, early diagnosis and treatment become even more important. Through genetic testing, blood screening, and supplementing necessary vitamins like folate, B6, and B12, many patients have not only experienced significant symptom relief, but some have even been completely cured. I hope today's discussion helps more people realize the impact of metabolic factors on mental health. We should also approach these issues from a more holistic perspective and find the most suitable treatment methods. Diagnosing metabolic psychiatric disorders isn't just about recognizing symptoms. It's a reminder that scientific treatment plans can help patients overcome mental health struggles and restore a better quality of life. If you're interested in learning more about genetic metabolic disorders, IEMS, and their connection to mental health, specifically metabolic psychiatric disorders, don't forget to like, subscribe, and share this with someone who might need it.